morning, everyone. My name's Jennifer, and I'm here today to talk to you about nurses, what we do, and I'm going to start off with a very interesting quote from Maya Angelou. She says, people will forget what you said to them. They will forget what you did, but they'll never forget how you made them feel. And that statement is really, that's the heart of nursing. Our job is to make you feel better. That's our job. And I'm sure everyone in this room has been around a nurse, they know a nurse, they've been taken care of by a nurse, they've witnessed a family member being cared for by a nurse. And you really, just watching them, if you watch a nurse, you can just really see they're in it to care, and they want to care for you. The reason I'm here today is I really want to encourage you to look at nursing as a career, really just see if it's something right for you. And hopefully if I do my job right today, I will get you to look into nursing. I want to start off with just telling you a little bit about myself and about my nursing career. I have been an RN now for 11 years. I have my associate's degree. I'm currently going back for my bachelor's degree at Liberty University. I've been critical care nurse for most of my career. I started out in ICU. I went to ER and trauma, and now I currently work in an outpatient surgery department in the recovery room. And the good thing about nursing is, just like me, you can move around with the same degree. You get your on-the-job training, and you can do different things. You get bored, or you're just not sure if you like one thing, you go and do something else. So we're going to explore nursing. The first thing I want to talk to you about is nursing is an identity. It's not just what you are, but it's who you are. I feel like I am a nurse. That's my identity. It's not just my job. And a scripture that comes to my mind, I think about, are unique gifts that were given to us by God. And that's 1 Peter 4:10, and it says, each of us should use whatever gifts that you have received and use it to serve others as faithful stewards of God's grace. That's really impactful. That really lets you know that this is a gift. It was given to you, and you really need to use that to bless other people. I'm going to talk to you about the duties of a nurse, what we do. And a quote from Torval and Ingalls is a book about caring and nursing. And it says, nursing duties depends on your specific area. So each nurse may not do the same thing. But at the core of nursing, we are there to provide physical care, but also emotional and spiritual care for not only our patient, but their family members. So some duties of a nurse, okay, well, what do we do? Physical assessment, what does that mean? I'm going to listen to your lung sounds. I'm going to check your dressing on your leg if you just had surgery. The doctors give us orders. Everything we do is based on what the doctor wants. So they give us either written or computerized orders, and we're supposed to implement them. We need to consult with the medical team. That's not only the doctor, but does that mean they need to go down and get physical therapy? They need to go to the x-ray department. They need to get some sort of testing. We coordinate that care throughout the day. We assist doctors with procedures. So depending on where you work, I personally work in the recovery room, so I may help a doctor put in a special IV line, it's called a central line, or a drainage tube, so you can assist doctors with those sort of procedures. Education, that's a big part of what nurses do. You go to your doctor's office and they say, okay, put this on your wound and change your dressing. Well, what does that mean? How many times a day do I put that on? What kind of dressings do I use? How often do I change it? Can I get it wet? So that's sort of the education that nurses provide. Emotional support. When people are sick, they're not at their best. We are here as nurses to not only take care of you physically, but that spiritual and emotional aspect of it, to hold your hand, to let you cry, to talk to you, to give you just reassurance that it's going to be okay. Now, another lovely part of nursing that we all love as nurses is charting. You have to chart everything you do. So now pretty much all charting is done on the computer. So you spend most of your day looking at the computer and charting. An important aspect of that is to not follow your focus on that computer, to focus on your patient as well, but still chart everything that you need to do and document it appropriately. Nursing is a very physical job. We stand on our feet all day long. We walk, I don't know how many miles from point A to point B from the nurse's station back to the patient's room. So that's just an important thing to remember. It is a physical job, so you have to think about that before you get into the profession. Some good qualities of a nurse. Now, not everybody can be a nurse. Not everybody can be a teacher. You know, so we have to look at what qualities make you a good nurse. Compassion is the biggest quality that you can have as a nurse. You may be good at doing stuff, but are you doing it compassionately? So compassion, the definition from Webster's dictionary, is a genuine concern for those that are suffering. Okay? So that's a pretty important thing to be able to do when you're a nurse. Also, you need to be emotionally stable. You need to know how to deal with your own emotions. You're dealing with somebody else's emotions. You could be taking care of somebody who just had a horrific car accident and lost their leg. Well, they're going to be very emotional. And you need to help them and to learn how to deal with your own emotions. Not that we don't show our emotions on our sleeve. We care. There's been times I cry after work. But I need to be strong for that patient right then and there. If I break down every time there's something sad that happens, I'm not going to be a good nurse for my patients. Critical thinking skills. So nursing involves, we are the front line of the doctor. We are at the bedside. We are the doctor's eyes and ears. So we need to be aware of what's going on. Any little change in our patient, we need to think about, okay, what can that mean? What else should I be looking for? What changes should I see in my patient? Attention to detail. It can't be laissez-faire, you know. What we do is very important. You know, we need to make sure we're giving the right patient the right medication at the right time. Our job involves a lot of multitasking. You leave the room to go get one thing, somebody else grabs you for something else. So you have to be able to multitask very well and also prioritize very well. You know, if somebody's vomiting and you're running out to go get them a medication and somebody stops to ask you a question or take a phone call, you have to prioritize what's more important. Probably taking care of that patient that's sick right this second. So now that I've talked a little bit about what a nurse does and the good qualities of a nurse, I want to explore education of a nurse, the career path and advancement. So the American